we're meeting today to consider 13 health bills. Today is actually the first markup of our subcommittee in this year, in 2020. Since our last markup, our subcommittee has been remarkably productive. We've held 8 hearings to consider 50 bills. So today we're going to continue that progress and by marking up 13 bills to improve the health care coverage and health care of the American people, while also improving access to affordable and safe products regulated by the FDA. Nearly every bill we'll consider today is bipartisan. We'll begin with the Cosmetic Safety Enhancement Act, which updates an 80-year-old federal law to increase federal oversight over the safety of cosmetics. Next, we'll consider 4 bipartisan bills to improve the drug supply chain. I think you all know that that's a top-line priority for me, from the very beginning of the chain to the very end, so that patients have access to quality products that are accurately labeled. The Modern Labeling Act will make sure generic drugs have up-to-date safety labeling, and the Safeguarding Therapeutics Act will protect against counterfeit medical devices. The National Centers of Excellence in Continuous Pharmaceutical Manufacturing Act supports the development of continuous manufacturing technology to strengthen and modernize U.S. drug production. The Fairness and Orphan Drug Exclusivity Act will close a loophole so that orphan drug exclusivity cannot be used to deny access to drugs for opioid use disorder. Next, 4 bipartisan bills aim to prevent the single greatest tragedy a family can experience, the death of their child. The FASTER Act requires food manufacturers to list sesame as an allergen on their products. An estimated 8% of American children have food allergies, and the NIH recently found that sesame allergy is common among those children. Without clear labeling, they are at risk for a serious allergic reaction, even death. The School-Based Allergies and Asthma Management Program Act also helps children at risk for allergic reactions by preferentially awarding children's asthma treatment grants to states whose public schools are ready to handle asthma and allergy emergencies. We'll also mark up the Scarlett's Sunshine Act. No family should suffer the death of a child without knowing why. And we had very powerful testimony on this issue. Yet over 400 children and 3,600 infants die each year from unexplained causes. The Scarlett Sunshine Act provides funding to improve data collection and death scene investigations related to unexpected deaths and promotes safe sleep practices. The Healthy Start Reauthorization Act invests $135 million annually to improve birth outcomes in high-risk communities. The Healthy Start program has reduced rates of low birth weights, preterm births, and prenatal opioid exposure. The Ensuring Lasting Smiles Act helps the 4% of children who are born with congenital anomalies such as cleft palate. Health plans often deny or delay claims for children with dental-related procedures. This practice leaves families in debt from high out-of-pocket costs despite paying for health insurance that should cover these procedures. The final 3 bills reform core pieces of the Medicare and Medicaid program. The Bennies Act updates the Part B enrollment process for the first time in 50 years. It requires Medicare to notify people nearing eligibility about their rights and responsibilities, protecting beneficiaries from a lifetime of financial penalties for failure to enroll promptly. That's quite a change for the first time in 50 years to update Part B enrollment. The Protecting Patients Transportation to Care Act requires state Medicaid programs to offer a non-emergency medical transportation benefit. Transportation to health services is a lifeline for patients. especially those who live in rural or underserved areas, with so many members representing those types of communities. While Medicare covers a lifetime of dialysis, kidney transplant recipients currently lose their Medicare coverage 36 months after transplant. This doesn't make any sense. The Comprehensive Immunosuppressive Drug Coverage for Kidney Transplant Patient Act closes that coverage gap. A nonpartisan HHS analysis found this policy would save 375 kidney transplants each year. So today's markup is bursting with common sense legislation, and I'm proud that we're advancing these 13 bills and continue our record of bipartisan productivity. And of course, I urge my colleagues to support them.